Scientific health benefits of turmeric and curcumin. There's no shortage of health claims about curcumin, the active ingredient in turmeric. But what does the research say? Turmeric can help fight inflammation, potentially helping reduce your risk of various chronic diseases. Curcumin is an anti-inflammatory. One of turmeric's main claims to fame is that it's commonly used to fight inflammation, and the bulk of turmeric's inflammation-fighting powers can be assigned to curcumin. In fact, in the right dose, curcumin may be a more effective anti-inflammatory treatment than common inflammation-fighting medications such as Advil, ibuprofen, and aspirin, according to a research. Because chronic inflammation contributes to many chronic diseases, curcumin may help treat conditions like inflammatory bowel disease, pancreatitis, and arthritis, according to some research. Curcumin may help protect against heart disease. A past study shows that curcumin may improve endothelial function, or the health of the thin membrane that covers the inside of the heart and blood vessels. This membrane plays a key role in regulating blood pressure. Lower endothelial function is associated with aging and an increased risk of heart disease. Thus, curcumin may help protect against age-related loss of function and reduce your likelihood of developing heart disease. Another study found that curcumin was equally effective at improving endothelial function in people with type 2 diabetes. Heart disease is a common comorbidity of type 2, as the drug Lipitor, atorvastatin, a medication commonly prescribed to reduce the risk of heart attack and stroke. Still, more research is needed to determine if curcumin is a safe and effective long-term treatment strategy for people with heart disease. Curcumin may help prevent, and possibly treat, certain types of cancer. As inflammation is linked to tumor growth, anti-inflammatory compounds such as curcumin may play a role in the treatment and prevention of a variety of cancer types, including colorectal, pancreatic, prostate, breast, and gastric cancers. Research in mice suggests that curcumin may help slow the spread of tumor cells and may even prevent tumors from forming in the first place. It may do this in several ways, including disrupting the formation of cancerous cells at various stages in the cell cycle, interfering with cell signaling pathways, and even causing those cancerous cells to die. Right up arrow. Whether curcumin can help treat cancer in humans has yet to be determined, but the research is ongoing. Researchers note that more studies are needed to assess the true impact of curcumin on prostate conditions like cancer. Curcumin may help ease symptoms of osteoarthritis. Thanks to its potent anti-inflammatory properties, curcumin may be a safe and effective long-term treatment option for people with osteoarthritis, OA. At least, that was the conclusion of the authors of a recent review of the clinical use of curcumin for the treatment of osteoarthritis. In a past study, right up arrow, people with osteoarthritis who took 1,000 milligrams per day of Meriva experienced significant improvements in stiffness and physical function after 8 months, whereas the control group saw no improvements. Meriva is a proprietary treatment made up of a natural curcuminoid mixture, 75% curcumin, 15% dimethoxycurcumin, and 10% bis-dimethoxycurcumin, phosphatidylcholine, a chemical found in eggs, soybeans, and other foods, and microcrystalline cellulose, a refined wood pulp commonly used by the pharmaceutical and food industries. Curcumin may help treat or prevent diabetes. According to a past review of studies, curcumin may help treat and prevent diabetes, as well as associated disorders like diabetic nephropathy, also called diabetic kidney disease, which affects people with type 1 diabetes and type 2 diabetes. One drawback: many of the studies were done only in animals, not humans. For example, one study found that feeding 80 milligrams of tetrahydrocurcumin, one of the main substances in curcumin, per kg of body weight to rats with type 2 diabetes for 45 days led to a significant decrease in blood sugar, as well as an increase in plasma insulin. Curcumin may help delay or reverse Alzheimer's disease. Turmeric may even help protect your brain against common degenerative diseases like Alzheimer's. How? By increasing levels of brain-derived neurotrophic factor, BDNF, a protein found in the brain and spinal cord that plays a key role in keeping nerve cells, neurons healthy, as well as regulating communication between nerve cells, which is critical for learning and memory. As common brain disorders like Alzheimer's are associated with lower levels of BDNF, turmeric, curcumin in particular, may help delay or reverse brain degeneration. Curcumin may play a role in depression treatment. Like Alzheimer's, depression is associated with lower levels of BDNF. Thanks to turmeric's ability to boost levels of BDNF, the spice shows promise as an effective antidepressant. In fact, one study found that rats injected with 50, 100, or 200 milligrams per kilogram of curcumin for 10 days had a dose-dependent increase in BDNF, with a higher dose of 200 milligrams per kilogram showing greater antidepressant effects. Curcumin may play a role in treating rheumatoid arthritis. Curcumin shows promise as a treatment for rheumatoid arthritis, RA, a chronic inflammatory disorder that commonly affects the joints, but may spread to other areas, such as the eyes, lungs, skin, heart, and blood vessels. Right up arrow RA causes a painful swelling of the joints that can cause the bones to erode over time and ultimately lead to deformities and physical disabilities. Turmeric may improve skin health. Thanks to its anti-inflammatory, antimicrobial, and antioxidant properties, turmeric may be an effective treatment for a variety of skin conditions, including acne, eczema, atopic dermatitis, photoaging, and psoriasis. Yet robust research is lacking. According to research, topical curcumin treatments may be useful in treating skin disorders, especially as past research suggests curcumin is relatively safe even at high doses. But curcumin's bright yellow-orange color, poor solubility, and poor stability at a high pH make it an unappealing topical skin treatment. Turmeric may work as an anti-aging supplement. Currently, there's no evidence that turmeric or curcumin directly influence longevity, but thanks to their ability to fight inflammation, protect your body against free radicals, and potentially delay brain degeneration and other age-related diseases, turmeric and curcumin may be effective anti-aging supplements, according to past research.